Hey. Oh, good, it's going. This YouTube Jer Bear from Act on Fats, I really want to be focused on the wall, okay, first of all, so I'm really upset that there's so much health, other health drama that it's not enough of the health drama that I've been ready for, because we've been working on, you know, artery declogging from trans fats, getting fluoride-free water, getting lead out of jet fuel, getting the radioactive road de-icer contract suspended in all these states that are using gas drilling waste brine in their road de-icers and de-dusters. We're warning folks about wireless radiation, the radiation at airport TSA screenings. We're for the Environmental Working Group, for Friends of the Earth, just for people avoiding mainstream toxins. So, this virus, like the whole, like, how to shield the virus, and like, if you're concerned about super spreaders, like, I would not want to be a super spreader, okay, karmically. So, and if you're planning the whole thing, why, I'm just going to explain it again. I just didn't do it because it's going to satisfy my need to regurgitate this information and kind of touch on some of the main points. So people are worried about that you're breathing in too much of your own CO2 with a tight mask. It's kind of a trade-off, because with a tight mask, you get to filter out dirty diesel engine exhaust, toxic paint fumes. So there's all these things that the N95 masks have made it less of a carcinogenic hazard to be at your workplace. I mean, we wish all the dirty diesels were retrofitted with particulate filters and only burning clean, renewable resources and stuff like that, but unfortunately, that's not the case, and a lot of folks need these. Now, with the medical uses, it is about the virus. So people are saying, how can the virus be such a small particle and still be filtered by these masks? And it's about viral load. So it's about the potency. If you get exposed to a lower amount, you could have a smaller case, okay, and a less serious case. And if you heard about, there's a citric acid layer built into the N95 masks. It's antiviral. It has antiviral properties. So if you're just wearing a face mask, if you're just wearing cloth masks, I just don't see your breath being like severely, like, it's not changed, like the amount of air, like my airflow. Like the cloth mask, it's meant so that if you're in public, you're talking, you may need to clear your throat. Even if you're not sick and you just want to clear your throat, like, I just sprayed a bunch of fucking droplets out of my mouth, just clearing my throat. So what, like, a small shield does is, even if the virus is big enough to get through these little holes, in cloth, which, like, you can totally breathe through your cloth. It's about catching some of the droplets, and if you're gonna be within 6 feet of somebody, they're gonna get a larger viral load from you clearing your throat near them than you would with no mask. So, like, it really supports safety and morale, and, like, people are so afraid of being breathed on, and I really, really, really think that people are being really selfish in saying that they won't wear a mask when folks are carrying a communicable disease, and that the disease could end up in the indoor air of a workplace where folks are trying to where folks need their indoor air to be clean, and the only ways to do that are with opening doors and getting a breeze wave through, and with these UV light sterilizing of the air. But the masks, when you're in with contact of people, like I said, it provides a guard so that there's a less potent, and you can say, oh, all the virus is gonna get through. Like, it may not be, 100%, but it's something, and I think we really have to be accommodating. And as somebody who's doing a health blog so that people make changes, I'm really glad to see folks wearing cloth masks or N95 masks in indoor spaces. When you're being a consumer, like, we've spent so much time like trying to limit the damage that our consumer lifestyles have, and it's so difficult with single-use plastic and like all the solid waste, all the food waste, all the diesel trucks that transport all the shit from the sweatshop factories. I mean, we know it's a nightmare. So you're already at a store, and you're gonna help the staff know that you're that there's a shield in between you, because some people spit when they talk, and some people are gonna be super spreaders. And if the super spreaders see your anti-mask propaganda and they decide to go out and don't have any covering for their breath, they're going to be a super spreader, and we really want to limit that. All right, so thanks a lot for listening.